Funding for Idaho Reports is provided by the Friends of 4, 10, and 12, the Corporation for Public Broadcasting, and by a grant from the Laura Moore Cunningham Foundation.
A committee of the Idaho legislature tried to buy some time today in an effort to salvage the state law requiring Idahoans to pay some of the nursing home costs of their relatives. The Department of Health and Welfare hasn't been enforcing the law, believing it unconstitutional. Tonight, with two state legislators and the Health and Welfare Director, we'll hear the debate about the controversial relative responsibility law.
Good evening. Over the last 10 years, no cost in the American economy has grown quite as fast as the cost of medical care. In Idaho, the state support for the Medicaid program, for example, has grown to $20 million a year, a tripling in the last 10 years. In an effort to control some of those costs, the Idaho legislature in 1981 created a voluntary program to encourage relatives to contribute part of the costs of nursing home and institutional care for members of their families. In its 2 years of existence, that voluntary program was something short of a success, only about $14,000 collected statewide. In 1983, the legislature approved a mandatory relative responsibility law, requiring Idahoans who meet certain financial minimums to pay some of the nursing costs of their relatives. By December of '83, the program was in place, and complaints about it had grown, so much so that an effort was made during the last session, the '84 session of the Idaho legislature, to repeal the law. It failed. But in March of this year, Idaho's Republican Attorney General, Jim Jones, ruled that law unconstitutional. Jones saying the law violated the requirement of general applicability. We'll talk more about that in just a moment. In May of this year, then, the federal government informed the Idaho Department of Health and Welfare that it agreed with the Attorney General's ruling, and the department started immediately shutting down the Relative Responsibility Act. Refunds were offered to those people who had already been assessed for their relatives' care. But today, a select committee of the legislature's two health and welfare panels rejected the department's decision to close down the program, leaving the issue tonight highly confused and certainly more controversial than ever. Tonight, we'll attempt to sort out all of this and focus on one essential question. Should people who can afford it be forced to pay some of the nursing costs of their relatives, remembering now that many of those costs are now absorbed by all of us? We begin tonight with a legislator who has been a principal author of the relative responsibility law in Idaho. Representative Chris Hooper of Boise is the chairman of the House Health and Welfare Committee. Just what are you trying to do today, Mr. Hooper, by, in essence, telling the department not to shut down this program?
Well, Mark, we thought that the Department of Health and Welfare did not go as far as it could have gone in trying to allow our program to work. This was strongly supported by the legislature. The governor backed our law and signed it a couple of years ago when it passed. The former director of the department was strongly supportive of this program. And we thought at least the department should ask the federal government for a waiver if in fact our law is not legal.
By a waiver, you mean?
That would allow us to continue the program on an experimental basis or a test case basis, even though it may have some technical difficulties.
And you've done this despite, as I mentioned, the Attorney General and the Federal Department of Health and Human Services saying, in essence, that the law is not constitutional.
Well, the Attorney General did say that. I think it was an unfortunate opinion. I'm not a lawyer, but I don't agree with the opinion. As I understand the letter from Margaret Heckler at Federal Health and Welfare, her letter said that since they didn't like to interfere with states, and since our state Attorney General gave this opinion, they would agree with that opinion. And my impression of that letter was that if our Attorney General had said fine, the feds would have said fine. So we think it's very, very murky from the federal point of view, and we'd like to get it straightened out.
Some have suggested just recently, and certainly it was suggested back when this was debated in the legislature, that ultimately the courts would have to decide whether this basic approach to this problem was legal. Is that what you're really looking for here?
No, not at all. I think we should avoid the courts whenever possible. But we just have some very unclear guidelines from the federal government. And since this is a Medicaid program, we have to operate within those guidelines. Some people apparently in Washington, D.C. want this to go forward. Some people don't. We're kind of caught in between the federal crossfire. And we would like our State Department to go the last step and ask for that waiver, and if in truth they don't get it, then either we change the Attorney General opinion, or we change the law, or we do something.
So where does the program stand right now?
I think the director would be able to answer that better, but I obviously...
But your point, your position is that we still have a valid law that's on the books.
There's a law on the
No
books.
one except the Attorney General has said that it's unconstitutional.
Right.
And that we ought to go ahead and see what we can do with that law.
I can understand the director not wanting to enforce the law after our Attorney General has said it's not a good law, because to ultimately enforce it, we would have to take somebody to state court, and our lawyers would be pretty hard-pressed arguing that somebody should be forced to pay on a law that the Attorney General said is not a good law. What we would like the department to do is go to the federal government and say, even though there may be some technical difficulties with this law, this is a good program that our governor and that our legislature is behind, and let us try it on a test case, because it could mean a heck of a lot of money for the federal government if all states did it.
Let me just ask you finally, and I have the Attorney General's letter that he sent to you and Senator Barker right in front of me, where he says, and I'll just paraphrase, in essence, you could rewrite this law, in his opinion, to make it constitutional. Why not just do that?
Well, we can do that simultaneously, but we can't until January when the legislature meets, and it takes quite some time to get some legislation passed. In the meantime, the Department of Health and Welfare in the state has had a good many months to ask for that waiver.
And haven't done it.
And has not done it.
We'll come back, sir. Thank you. Our second view of this tonight comes from the director of Idaho's Department of Health and Welfare, Rose Bowman. Ms. Bowman, where do things stand now, as far as you're concerned?
Well, we're simply doing what the Attorney General recommended that we do, and that is that we're not enforcing the law.
Will that change after what Representative Hooper and the other people on his committee did today?
We will go about seeing if there is a possibility of some kind of waiver. The chances are very slim of that. There's probably no authority. That had never occurred to us, because it doesn't occur to us to ask for waivers of laws that Congress has passed. In other words, what we'd be asking to waive is a law, not a rule and regulation of Health and Human Services, which is a possibility. So we are pursuing, and this afternoon we have made phone calls, and we are in the process of finding out if it's even a remote possibility. At this point, it's real conflicting as to where it stands, but still the last word has been that this is a law in the Social Security Act. It is a law passed by the Congress of the United States, and you don't ask for waivers of those kinds of laws.
Okay, let me just clarify this bit of business about a waiver. Sometimes it is possible to ask for a waiver of a rule or an administrative ruling about how a law should be, in fact, implemented.
Exactly.
But your opinion is that this is a law and not a ruling. The Congress passed this. This is the law of the land.
That's at this point, but we are inquiring. We are not just leaving it at that. We are going every avenue that the committee this afternoon asked us to go to see if it is a possibility. In the first place, we would never have thought of going after a waiver of a United States law, and on the other hand, we would have been conceding that this law was not a law of general applicability. So we would have been defeating our own purpose. We were, as a matter of fact, until the Attorney General's opinion, enforcing the law and collecting on relative responsibility. So,
as I mentioned, this term general applicability, just try to define that for me a little bit better so that those of us who are not as well versed in these things as you are can understand.
The simplest way to explain it is that in the law it defines Medicaid recipients as the recipients who we would go after for this funding. In other words, the relatives of people who are on Medicaid.
Okay.
And that's the word that really puts this into, not into the proper framework.
Okay. You heard Representative Hooper say that this was a law that was passed by the legislature, signed by the governor with the support of your predecessor in the department. I think some suspect that maybe the department under your leadership has not been as, frankly, as wild about this idea as the predecessors were.
We were enforcing it. I was there when we were enforcing it. That's certainly, there's no proof to that. I don't look at this as a game of roulette. I look at it as a responsibility to the citizens of the state of Idaho. When the Attorney General tells me that he recommends that I do not enforce the law, I have to go with what the legal interpretation is.
So just to repeat for emphasis, you are looking into the waiver, but I guess you're not very optimistic that it would come about.
Not at this time.
Okay, thank you very much. And finally now, the view of a legislator who has long been in opposition to this program and in fact requested the Attorney General's opinion that has already been discussed here. State Senator Terry Riley is a Democrat from Nampa and a member of the Senate Health, Education, and Welfare Committee. Senator, you've fought this idea all along. What should the department be doing now? You've heard the department's view of things and Representative Hooper's view. Where should the department come down?
Well, I think two directions. Firstly, I think that we have to develop some in-state alternatives to the spiraling cost of care, because it is a problem. The cost for elderly care is increasing on a daily basis, and I think that there are some alternative methods which we would better put our attention on those areas than on this relative responsibility area. So that's the first. The second area is that we have to view the Idaho experience with relative responsibility within a national context. Idaho is not the only state viewing relative responsibilities. Many other states have. If there is to be something done in this area, I think it needs to be done in concert with other states.
Should the department request a waiver, try to request a waiver to see if this law can be implemented?
Oh, I don't think a waiver is what it's going to take. I have had some personal dealings with people in the healthcare financing administration as well as people on Secretary Heckler's staff. Basically what we're dealing with here is...
That's Margaret Heckler, the Secretary of Health and Human Services.
That's correct. Basically what we're dealing with here is a very politically explosive issue, and they're not going to do anything until after the election and a lot of the dust settles however the election comes out, because we're dealing with healthcare costs and the incredible healthcare industry as well as senior citizens. But I do think that taking the waiver approach is probably not the most productive approach. They would be better to deal through the Medicaid agencies and the organization that they have on a statewide basis, as well as dealing with the National Conference of State Legislatures to come up with further positive development of this policy. We're dealing with a public policy issue.
Okay, but beyond the policy, the specific law we have on the books in Idaho now is not a good law in your view.
That's correct.
And it should, and you agree with the Attorney General in his opinion?
Absolutely.
That it's unconstitutional?
Yes.
And so the department ought to have made the decision it made not to enforce that law?
I think that was a correct decision on the part of the department.
Okay, let me go back to your opposition to this when it first came to the legislature. Why is it a bad idea?
I opposed it for three reasons. Firstly, I felt that as a taxing measure it was overly regressive and therefore not good policy. Secondly, from a matter of collections, we were trying to collect $5, and then this last session it was amended so that we could collect it in $15 increments. That's not good collection policy, as any businessman would be able to attest to. Thirdly, I felt all along that...
Let me just interrupt you there to say that, not collecting enough money to make the program worthwhile?
That's right. We're going after too small of amounts when we're starting at $5 and trying to collect $5 one month and $5 the next month. Even if we do it in a quarter and try to collect $15, it costs us more to collect that money than it's worth. My third reason for opposing it is I felt all along that there was a clear message from the federal government that indeed that the law would be unconstitutional. Other states drafted legislation prior to Idaho, and that was the advice the HCFA, the Healthcare Financing Administration, gave them, and they listened to the advice and didn't go ahead with it. Idaho went ahead with it. I think that we were in a rush to be the first state in the nation to adopt this type of public policy, and as a result, we blew it. We just didn't have the ducks lined up. We didn't have the administrative procedures taken care of. We didn't have legal opinions on it. We didn't have it approved as part of the Medicaid plan, and we just got ourselves into trouble.
Let me ask you finally, could this law in some way be written, or this concept, I guess you're saying this concept could be made to work, just not in the form that it exists in Idaho now. We could take this basic philosophical position and mold it into something that would work.
I think so, yes.
Okay, we'll explore that more in just a moment. Let me open this up and go back to Representative Hooper first. You heard Ms. Bowman say that she's going to try for the waiver, but it's not optimistic because it's a law and not a rule that they're asking to be waived.
She would have more expertise on that than I. My understanding was that this whole thing came about because of a reinterpretation of a rule. But if in fact it is a law, then I'd have to concede that it's a law. But let's ask for the waiver and find out.
Okay, and that's what you're doing.
Yes, and of course the waiver process is a very lengthy process, and it also takes a lot of time. The forms you have to fill out are probably, 3 inches high. So it's not something that we're going to find out in 1 day, 1 week, but we will, start the process if we're given any indication that it's a possibility.
Is that satisfactory?
All we can ask is they do their best.
I don't want to put words in your mouth, but it almost seemed earlier that you were suggesting that maybe the department had not been as much behind this as you would like.
That'd be a fair statement.
Okay.
Yes.
Based on what? Just on...
Based on the fact that, number one, they did not start the waiver process in May when the opinion came out. That's essentially it. Just less enthusiasm than we would like, although certainly Mrs. Bowman was enforcing the law, and I understand that the enforcement was costing us much less money and it was much easier than what the department originally thought it would. But a couple of things I'd like to mention, Mark. We weren't really in a rush to be first with this thing. We were in a rush to overcome some severe financial troubles that the state had. Now, at the time we passed this law in the '83 session, we came very close to removing the eligibility for several hundred residents of nursing homes. If in
just
fact,
because the state had run out of money to
we
pay
didn't have
those
the money.
bills. Right.
Right now, the governor had to propose a 3% holdback. I understand the department's Medicaid is only 1.5% holdback. There's $200 and some odd thousand that will not be collected here. There's, I guess, a $500,000 shortfall in some federal law that either shortfall or more responsibility that you have to have. The department is not going to be rolling in money, which means that if they in fact lose the $1 million and $900,000 that we think they will with all these three circumstances, that's about 90 to 100 people who will not be paid for under Medicaid in nursing homes. And what are we going to do with those 90 people?
And so if let me just ask one quick follow-up. The rush then, if there was a rush, was to meet the financial
We were
problem.
broke.
Okay.
I just wanted to thank Representative Hooper for supporting the Department of Health and Welfare in our appropriation bid, because we appreciate that support and we do need money to do good services. But one thing I want to point out is I don't think we should lump together all those other issues. I think we have a clear issue here with $225,000 that was put into our budget as the projected possibility of receipts from this Relative Responsibility Act. That was money we never had. We planned on it, but that's all it was. It's $225,000 that we're haggling over here. And out of that comes the expense of the program and of administering the program. That is not just pure and simple money that we could spend to match and so on. So let's separate the issues. We can talk about that other deficit spending bill that the administration has put down on us. I don't know whose deficit spending it's going to reduce, but it certainly isn't the state's. But that's another issue. Right now we're talking about relative responsibility and the $225,000, which we never had, that we'll have to take out of our budget.
But which was in fact relied upon in setting the budget.
That
I mean, if I tell my son I'm going to give him $200 a month for his school expenses and I decide to only give him $100 a month, maybe he didn't have that money, but he's sure going to feel not having it.
In a budget of $213 million, I think we can think of more productive ways to reduce health care costs, and especially in the Medicaid arena. One of the ways 3 years ago they came up with a reimbursement.
So you're agreeing, excuse me, you're agreeing with Senator Riley that this maybe wasn't the best way to try to reduce these costs, or a cost-effective way to reduce the costs.
We have a lot of ways that we're working on right now, and you will see in the legislature that really attacks this in in a very studied, very legitimate way. And I think that it will be ways that we can really, once and for all, get at the, in this case, at nursing home costs. Those costs are getting to us, and we must find a way. Our caseload is also going down a bit, which is a direct result of some other kinds of services that we are delivering now, personal care and also the homemaker services for nursing homes. So there's a whole spectrum of things that we can do. We have not thrown out cost containment. Let me reassure you of that. We're very much aware of that, and we want to do what we can.
Well, let me go back to a point that Senator Riley made earlier about in-state alternatives. You talking about the same kinds of things that Ms. Bowman just mentioned?
Some of those certainly. Anything that we can do to keep a person out of a nursing home will save the taxpayers money, provided the alternative is less expensive. There are a variety of elderly services that can be provided on a home-based program. It's my opinion that Idaho has, to this point, not vigorously pursued many alternatives. We have been too easy just to have a person go to the nursing home and then to pay those expenses.
By an alternative, give me an example.
Well, I think that if we were to work through the 7 district health departments, more so for establishing home health services for elderly people, if we can keep a person out of a home for a month or out
Where
of 2
they get a nursing
months,
visit at home instead of institutional care.
we would be dealing with a $35 charge rather than several $100s per month for the institutional care.
In fact, though, Mark, we do have those laws on the books for some in-home services and for some alternate nursing services, which we ought to pursue. But if all of these alternative methods work, and I sure hope they do, and I'm going to support most of them as they come across, then maybe we should lower the tax burden rather than spending the money elsewhere.
Well, what we have in society is such a large number of people becoming older that the burden on the healthcare system and the nursing home system and the in-home care system is just tremendous, as I think we're becoming more and more aware. Anything we can do now to implement and institute programs early on will save money later on because of the demands which will be on the tax system later on in order to pay for those cares if we don't change the system now.
Well, let me just go back to the question. I'd like to spend the last few minutes here on the basic question that I asked at the beginning about should people who can afford it be forced to pay some of the costs of their relatives? That's the concept, right, Representative Hooper? That's basically what we're talking about.
The basic philosophical question, Mark, is should the government be the first to pay or should it be the last to pay? And with this law, we're saying that the government does have a responsibility, but so does the family. So to the extent that the family can help, the family must help. To the extent that they cannot help, then all of us acting through the government will help. The obvious argument is that the government should be first, and I just don't accept that.
Do you agree with the way he stated the question, Senator?
Well, I think so. I think it's the question of is the government going to pay or is the government going to require the individual to pay? And I don't think the government should be the first in line on this. But similarly, as one of my points of opposition, I don't think that it's something that we should kick in at poverty level. It just isn't cost effective to try to be going out and collecting $5 from someone who's at poverty level. And I think that that was one of the procedural problems with the bill. Had we waited, we would have straightened that out.
Mr.
Well,
Hooper?
that was a procedural problem with the regulations, because the potential regulations that we were looking at while we were passing the bill did not have that. Through the departmental's hearing process, which was a very good process, more people around the state favored the type of regulations that the department came up with, which had the effect that you mentioned. So that wasn't a legislative problem, it was a regulation problem.
Well, we've got basic agreement from the two politicians on either side of you about whether people who can afford to pay should be, in effect, required to pay. Do you agree?
The theory of families taking care of their own is certainly a concept I think that everyone agrees with. We all should care enough about our own relatives that we want to take care of them. And that certainly in concept is right. And beyond that, we have tried to do what the legislature and then our top legal officials have told us.
But in effect, it is right now, for all practical purposes, it is just a theory that people should take care of their relatives, isn't it? I mean, the theory,
Well, some
the
people-
reality bumps into the theory right there, doesn't it?
Well, we have some volunteers who do give money into the volunteer fund that we have established.
And when we look at the institution, like in my hometown, the Idaho State School and Hospital for the mentally retarded, many of the parents who have children there, they do provide some of the services. They do routinely go out and help take care of the child and provide some of the personal necessities. So they are providing some of those services.
And some who have a great deal of money and could provide a substantial portion of the cost of the care do not. We have, this legislature, over the past number of years, Mark, has provided a great many carrots for people to help take care of their own. We have tax credits. We made some more tax deductions for people who are taking care of older people. This happens to be a stick to go with the carrot.
Yes.
Well, there happens to be one other minor problem with the bill, too, the constitutionality of equal treatment. At this time, if a relative lives beyond our borders, our state borders, there's some question as to the constitutionality of charging someone within our borders and not charging equally for someone who does not live within our borders. So I think that there's another problem with this law.
If all of these problems could somehow be addressed, would that be a good idea? Would it be a good idea to follow through on the theory that folks have some responsibility to take care of their relatives?
We'll do what the legislature tells us to do.
No, I'm asking you for a
For
judgment as to the basic
concept-
societal need
The
for such a thing.
Basic societal concept of people taking care of their own is certainly a sound concept.
It's just a matter of trying to make it fair. Can it be done?
I think so. It takes the first step. I think Idaho has made the first step. Nationally, Mark, we're talking a substantial amount of money, $750 million, something like that, if every state did have this type of law. Substantially important for reducing the federal budget.
I'm wondering, though, I've heard it from a number of people, that if you were to come back even with a law that met a lot of Senator Riley's objections, for example, that you'd have trouble mustering the votes to get it through the legislature again, just because the positions have hardened up and, as the senator suggests, it's a hot political topic.
Mark, this is such a clear concept, with Senator Riley agreeing with the concept. If he and I get together on it, I'm sure it would pass unanimously.
Senator, it'd be tough to pass it again, wouldn't it? Even in a redrawn version to eliminate some of the problems.
Well, two things. I think it'd be tough to pass it again, and secondly, it'll be tough to get reelected in order to sit down with Representative Hooper to even work on it.
Okay. Finally, Ms. Bowman, you would expect, what, several months before you get some reasonable response to your request?
I think the committee asked for us within a week to have some kind of answer, and we have started on it this afternoon, so I think within a week we'll at least have some feeling for which direction we can go.
Well, our thanks to you all. Senator Riley, Ms. Bowman, Representative Hooper, thank you. We appreciate you being here tonight. That's our time for tonight. We'll be back tomorrow with other news permitting, an interview with Idaho Republican Senator Steve Symms. I'm Mark Johnson. Good night.
Funding for Idaho Reports is provided by the Friends of 4, 10, and 12, the Corporation for Public Broadcasting, and by a grant from the Laura Moore Cunningham Foundation.